Look at your fingernails right now. Press down firmly on one of them for about 2 seconds, and then let go. Watch how quickly the color comes back. What you just did is something cardiologists use to assess circulation in a matter of seconds without a single piece of equipment. And what that simple test reveals, along with 3 other visible nail signs, can tell you something most adults over the age of 60 never get told. Your nails are quietly recording what your heart and your blood vessels are doing every single day. The problem is that almost nobody is taught how to read them. And after the age of 60, when cardiovascular problems tend to develop quietly without dramatic symptoms until something serious happens, the signs that appear on your nails become one of the few warning systems that does not require a hospital visit to read. I am Dr. Ben Walker, and after more than 20 years focused on preventative health for adults over 60, I want to show you 4 specific nail signs that have been linked in medical research to heart attack risk, stroke risk, and serious circulation problems. The 4th sign is the one I most want you to see before this video ends. It is one you can check in about 3 seconds, and most people are genuinely surprised by what they find. Before we go any further, drop your age in the comments right now, and tell me whether anyone in your family has ever had a heart attack or a stroke. Because your answer is going to be relevant to how seriously you should take what we are about to cover. And if this kind of content is something you find genuinely useful, a quick like really does help me keep making it. To fully understand why these 4 signs matter so much after the age of 60, you need to understand a little bit about what your nails are actually doing biologically. Your nails grow from a structure called the nail matrix. It is a layer of living cells just beneath the base of each nail, and those cells are in constant contact with your bloodstream. They respond to changes in oxygen levels, circulation quality, and the health of the smallest blood vessels in your body. The capillaries beneath your nail bed are some of the tiniest blood vessels you have. And because they are so small, they are usually the very first to show signs of trouble when your cardiovascular system starts to struggle. For someone in their 30s, the heart and blood vessels have enormous reserves, and the body can mask early dysfunction for a long time without anything showing up on the nails. But after 60, those reserves narrow. Not because the body is broken, but because it has been running efficiently for 6 decades, and the margin for quiet dysfunction is thinner. Think of your nail bed as a window into the smallest blood vessels in your body. When those vessels start to struggle, the nails are often the first place that struggle becomes visible. Your doctor is not necessarily examining your nails during a typical 15-minute appointment because there is only so much ground a doctor can cover in that time, and nail examination, unless something is visually alarming, rarely makes the priority list. So the information exists in medical literature. It just does not always make it from the clinical setting to the person who actually needs it. Let me walk you through these 4 signs one by one. Stay especially focused on number 4, because it is the one almost nobody has been told to look for. Number 1 is a color change called cyanosis. And there is an important distinction here that most people have never been taught, and it changes how urgently you should respond to what you see. What cyanosis refers to is a bluish or purplish tint visible through the nail bed, especially near the base of the nail. But there are actually 2 different kinds, and they mean very different things. The first kind is called peripheral cyanosis. This is when the bluish color appears only on your fingernails, and maybe your toenails. Your lips, your tongue, the inside of your mouth all look normal and pink. Peripheral cyanosis develops gradually over weeks or months. It is your body telling you that circulation to the extremities is not what it used to be. It is a warning, but not an emergency. The second kind is central cyanosis. This is when the bluish color appears not just on your nails, but also on your lips, your tongue, and the inside of your mouth. Central cyanosis is a medical emergency. It means the blood leaving your heart is not carrying enough oxygen, and it requires immediate medical attention. What is happening biologically in both cases is that the blood reaching those tissues is not adequately oxygenated. In peripheral cyanosis, the problem is usually with circulation. In central cyanosis, the problem is usually with the heart or the lungs themselves. Research suggests strong associations between persistent peripheral nail bed cyanosis and conditions including early-stage heart failure, certain heart valve problems that go unrecognized for decades, and chronic lung diseases that eventually put strain on the heart. The reason this matters so much for people over 60 is that heart failure prevalence rises sharply with age, and it is one of the most frequently underdiagnosed conditions in the older adult population. Early-stage heart failure often does not cause dramatic symptoms. There is no chest pain. There is no collapse. There is just a slow, quiet decline in how efficiently the heart is working, and the body compensates until it cannot compensate anymore. A patient story I want to share with you, a composite of the kind of presentation I have heard described many times, involves a retired postal worker named Frank from Sarasota, Florida. Frank had noticed for nearly a year that his nails seemed to look slightly purplish at the base, especially in the mornings and after he had been sitting still for a while. He attributed it to cold weather, to poor circulation that he assumed was just part of getting older, and to the fact that he had always run cold. It was only when his daughter visited from out of state and commented on the color of his nails that he brought it up at his next routine checkup. His doctor examined him carefully, ordered an echocardiogram, and discovered early-stage heart failure that was still highly manageable with the right medication and lifestyle adjustments. Frank avoided a hospitalization that almost certainly would have happened within the following year. The practical takeaway here is straightforward. Examine your nails under good natural daylight, ideally near a window. If the color near the base of your nail bed looks bluish or purplish, and that color does not change when your hands warm up, that is something worth bringing to your doctor's attention. Specifically ask whether an echocardiogram might be appropriate given your age and your other risk factors. And if you ever see bluish color on your lips or tongue along with your nails, do not wait for an appointment. That is an emergency. Have you ever noticed any color change in your own nails? Type the word heart in the comments right now if you want me to do a full deep dive video on heart failure warning signs you can spot at home. I read every comment, and the topics that get the most engagement are the ones I prioritize next. Number 2 is brittle, slow-growing nails, and this is one that almost everyone over 60 dismisses as just part of getting older. What I am describing is nails that break easily, that peel in layers, that split vertically along their length, or that simply do not seem to grow at the rate they used to. You used to need to trim them every 2 weeks. Now it seems like they barely change month to month. What is happening here is that the nail matrix is not receiving the steady supply of nutrients and oxygen-rich blood it needs to produce healthy new nail tissue. And one of the most common reasons for that in older adults is a condition called peripheral artery disease, often shortened to PAD. Peripheral artery disease is what happens when the arteries that carry blood to your extremities, your arms, your legs, your hands, become narrowed due to plaque buildup. And here is the part that most people are never told. The same plaque that causes heart attacks when it forms in the arteries of the heart, and the same plaque that causes strokes when it forms in the arteries leading to the brain, is the same kind of plaque that builds up in the arteries leading to your fingertips. Plaque in one artery means plaque is likely forming in others. That is why peripheral artery disease is considered one of the strongest predictors of future heart attack and future stroke. People diagnosed with PAD have a significantly elevated risk of major cardiovascular events compared to people without it. And here is what surprises most people. PAD is often silent for years before any dramatic symptom appears. But there is a specific pattern of warning signs that tends to appear together, and recognizing the combination matters more than recognizing any single one. The pattern is this: brittle, slow-growing nails, cold hands and feet that take a long time to warm up, and cramping or heaviness in the legs when walking, especially uphill or upstairs, that goes away when you stop and rest. This last symptom has a specific clinical name. It is called claudication, and it is one of the most reliable signs of significant arterial narrowing. If you have all three of these things together, the brittle nails, the cold extremities, and the leg cramping that comes with walking distance and resolves with rest, that combination is genuinely worth a conversation with your doctor. A composite patient story that illustrates this well involves a woman named Eleanor from Burlington, Vermont. Eleanor had been a passionate gardener her entire adult life. When her nails started becoming brittle and splitting easily in her late 60s, she blamed it on years of working with her hands in the soil and on the dry Vermont winters. She tried supplements, she tried nail strengthening treatments from the drugstore, and nothing seemed to help. The change that prompted her doctor to look more closely was something she mentioned almost as an afterthought during a routine visit. She said her legs felt heavy when she walked uphill, something that had been getting slowly worse over about 18 months. Her doctor performed a simple test called an ankle brachial index, or ABI, which compares blood pressure at the ankle to blood pressure at the arm. The result confirmed moderate peripheral artery disease. With aggressive lifestyle changes, a structured walking program, and the right medications, Eleanor reduced her cardiovascular risk dramatically. Her brittle nails were the first sign anyone had noticed, and they had been telling the story for nearly 2 years before it was caught. The practical takeaway here is this. If your nails have become noticeably more brittle in the last 1 to 2 years, and you have any sensation of heaviness, cramping, or fatigue in your legs when you walk, especially uphill or upstairs, ask your doctor specifically about an ABI test. It is simple, it is non-invasive, and it can catch peripheral artery disease at a stage where intervention makes an enormous difference. Now, number 3 is the one I told you about at the start of this video. This is the one I want you to actually do with me right now. Number 3 is called the capillary refill test, and you can do it on yourself in less than 5 seconds. Here is how it works. Hold your hand at the level of your heart. Pick any fingernail. The index finger works well. Press down firmly on the nail with the thumb of your other hand for about 2 seconds. You will see the nail bed turn white as the blood is pushed out of the tiny capillaries underneath. Now let go and start counting. 1001, 1002. Watch how quickly the normal pink color comes back. In a healthy adult with good circulation, that pink color returns in under 2 seconds. If it takes 3 seconds or longer, especially repeatedly across multiple fingers, that is a sign that the smallest blood vessels in your body are not refilling normally. There is also a second test you can do alongside this one that doctors find useful. Press the back of your hand gently against your forehead or your cheek. Your hand should feel close to the same temperature as your face. If your hands consistently feel noticeably cooler than the rest of your body, even in a warm room, that is another marker of reduced peripheral circulation. Doing both tests together gives you a much fuller picture than either one alone. What is happening biologically with the refill test is that it measures the speed at which your microvascular system, the network of the tiniest blood vessels in your body, recovers from pressure. Slow refill means that the circulation in those small vessels is sluggish. And research has linked persistently slow capillary refill in adults over 60 to a range of cardiovascular concerns, including reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. The microvascular system is often where cardiovascular trouble shows up first, because the small vessels have less reserve than the larger arteries. One important note before you panic. If your refill is borderline, around 2 to 3 seconds, that alone is usually not cause for alarm, especially if your hands are cold or you are taking certain medications. Some blood pressure medications and beta blockers can slow capillary refill slightly without indicating any problem. Repeat the test in a warm room with warm hands, and if it is still consistently 3 seconds or longer across multiple fingers, that is when it becomes meaningful. The reason this test matters so much is that it gives you immediate, actionable information using nothing but your own hands. You do not need a doctor. You do not need equipment. You do not need an appointment. You just need about 5 seconds and good lighting. A composite scenario that shows the value of this test involves a retired postal worker named Walter from Topeka, Kansas. Walter had watched a similar tip on a daytime health program and decided to try the capillary refill test on himself one evening. He counted nearly 5 seconds before the color returned on his index finger. He tried again on his thumb, on his middle finger, on his other hand. The result was the same. The next morning, he called his doctor's office and described what he had observed. His doctor asked him to come in, performed a full cardiovascular workup, and discovered that Walter had undiagnosed atrial fibrillation, a heart rhythm problem that is one of the leading causes of stroke in older adults. Walter was started on appropriate anticoagulation therapy that, according to current cardiology literature, likely prevented a major stroke within the following 12 months. The practical takeaway here is to actually do the test. Right now, before you finish this video, do it on at least 3 different fingers. Do it in a warm room with warm hands so that cold temperature is not affecting the result. If your refill consistently takes 3 seconds or longer across multiple fingers, write that down and bring it up at your next medical appointment. Specifically ask whether a cardiovascular evaluation, including an EKG and possibly an echocardiogram, would be appropriate. Tell me in the comments right now how many seconds your refill took. I read every reply. And before I get to number 4, the one I told you almost nobody knows about, if this video has been helpful so far, a quick thumbs up genuinely makes a difference in whether the channel reaches more people who need this information. Number 4 is the one I have been saving, and here is why this one earns the final position. Number 4 is changes to the lunula, and most people listening right now have never heard the word lunula in their life. Look at the base of your nail, right at the bottom, just above your cuticle. Do you see a small whitish crescent shape, almost like a half moon at the base of the nail? That is the lunula. It is the visible portion of your nail matrix, the part where new nail tissue is being formed in real time. And the lunula is one of the most overlooked diagnostic signals in the entire body. Here is something most people are never told about the lunula. The pattern of which fingers have visible lunulas matters as much as whether they are there at all. In a healthy adult, the thumb and the index finger almost always have a clearly visible lunula. The middle finger usually does. The ring finger sometimes does. The pinky often does not, and that alone is completely normal. So if your pinky has no visible lunula, but your other fingers do, that is not concerning. What is concerning is when the pattern changes. When lunulas you used to be able to see on your thumb and index finger have disappeared. When lunulas across all your fingers have become barely visible. Or when the color of your lunula has shifted to something other than the normal pale white. The color shifts are particularly telling, and each one points in a different direction. A reddish lunula has been associated in some clinical research with congestive heart failure and with rheumatic conditions affecting the heart. A bluish lunula can suggest the same oxygen and circulation problems we discussed earlier with cyanosis. A very pale lunula that has nearly faded into the rest of the nail can suggest anemia, which has its own significant connection to cardiovascular strain. The reason this deserves the final position in today's video is that the lunula is something almost no one is taught to examine, and yet it is one of the most accessible, visible signals your body has. Most people have never been told to look at the base of their nails for anything other than infection. And so a sign that could have prompted a conversation with their doctor goes unnoticed for years. A composite case that I find particularly instructive involves a grandmother named Dorothy from Asheville, North Carolina. Dorothy was 72 years old and had been generally healthy her entire life. During a phone conversation with her daughter, who happened to be a nurse, she mentioned almost as a joke that the little white half-moons on her fingernails seemed to have disappeared. She could not even remember when they had been there last. Her daughter encouraged her to bring it up at her next physical, which Dorothy did, somewhat reluctantly, because she felt silly mentioning her nails. Her doctor took the observation seriously, ordered a complete blood count, and ordered a cardiovascular risk assessment. The blood work revealed significant anemia that had been developing slowly. The cardiovascular workup revealed early signs of strain on her heart. Both conditions were addressed before they progressed to anything that would have caused a major event. The lunula change was the first observable sign, and it could easily have been missed for another 2 or 3 years if her daughter had not encouraged her to mention it. The practical takeaway is simple. Look at your thumbs and your index fingers right now under good natural light. If your lunulas are entirely missing across most of your fingers, if they have noticeably shrunk in recent years, or if they have changed color, that is something to bring up at your next medical appointment. Ask specifically for a complete blood count and for a cardiovascular risk assessment. Now that we have covered all 4 signs, let me give you a practical framework for what to do with this information. Because knowing something and acting on it are 2 different things, and I want to close that gap for you. Start today by doing something simple. Take both of your hands to a window with good natural daylight. Examine each nail. Note the color of the nail bed. Note whether you see any bluish or purplish tint. Note whether the nails feel brittle or look like they have been growing slowly. Do the capillary refill test on at least 3 different fingers and time it. Look at the base of each nail for the lumula and note which fingers have visible ones and which do not. Take a photograph of both hands. Having a visual record over time is genuinely useful because changes that are gradual can be hard to remember accurately. This week, if any of what we covered today matched what you observed on your own hands, write it down. Note the specific sign, which fingers showed it, and roughly how long you have noticed it. Bring that written note with you to your next doctor's appointment. Within the next 30 days, if you observed 2 or more of these signs together, do not wait for your annual physical. Call your doctor's office, describe what you have seen, and ask whether a nurse can do a quick phone triage to help you determine whether you need to be seen sooner. And most importantly, please do not diagnose yourself based on any single sign in isolation. What matters is the full clinical picture, including your medical history, your current medications, your other symptoms, and what your doctor finds when they examine you. The purpose of today's video is to make you a more informed participant in that conversation, not to replace it. Here is what I want to leave you with. Your body has been communicating with you your entire life. It has been sending you signals, some loud, some quiet, every single day. And the remarkable thing about being over 60 is that you have more context, more lived experience, and more access to medical support than at any other point in your life. The 60s, the 70s, and the decades beyond are not a time when meaningful health changes become impossible. The research consistently shows that early detection and informed attention to these kinds of signals can dramatically alter outcomes, even in later decades of life. The nails you looked at this morning and maybe dismissed as nothing interesting may be the most accessible diagnostic window your body has given you. You just needed to know how to read them, and now you do. If you found this video helpful, please consider subscribing to the channel. It genuinely is the best way to make sure you do not miss what is coming next. And if someone you care about could benefit from knowing these 4 signs, a spouse, a sibling, a friend, please share this video with them. The next person you forward this to may be the one who notices something on their own hands tonight. I will see you in the next video.